Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is ADHD versus bipolar disorder. ADHD versus bipolar disorder, key differences and similarities. Attention deficit hyperactivity disorder or ADHD and bipolar disorder are two distinct mental health conditions that can share some overlapping symptoms, making differential diagnosis challenging. Both disorders can affect mood, energy levels, and behavior, but they have different underlying mechanisms, course of progression, and treatment approaches. This video will explore the main differences and similarities between ADHD and bipolar disorder. Let's look at attention deficit hyperactivity disorder characteristics and symptoms. As mentioned in previous videos, ADHD is a neurodevelopmental disorder characterized by persistent patterns of inattention and/or hyperactivity impulsivity that interfere with functioning or development. It is most commonly diagnosed in childhood before age 12, but can persist into adulthood. The core symptoms of ADHD can be divided into two categories: inattention and hyperactivity impulsivity. With inattention, people often struggle to maintain focus on tasks, are easily distracted, have difficulty organizing activities, and may frequently lose things. They may also make careless mistakes in tasks that require attention to detail and might avoid to be reluctant to engage in tasks that demand sustained mental effort. With hyperactivity and impulsivity, people might display excessive fidgeting, talk excessively, interrupt others, and have difficulty staying seated in situations where it is expected. Impulsivity can also manifest as difficulty waiting for a turn, making snap decisions, or engaging in risky behaviors without thinking about the consequences. The symptoms of attention deficit hyperactivity disorder can cause significant impairment in academic, social, and occupational settings. However, the symptoms do not cause a marked shift in mood, and there is typically no distinct period of elevated or depressed mood like in bipolar disorder. Now let's look at bipolar disorder characteristics and symptoms. As mentioned in a previous video, bipolar disorder is a mood disorder characterized by extreme shifts in mood, energy, and activity levels. The hallmark feature of bipolar disorder is the presence of manic and depressive episodes. These episodes can vary in severity and duration. During mania or hypomania episodes, people with bipolar disorder may experience elevated or irritable mood, increased energy, decreased need for sleep, racing thoughts, and excessive involvement in risky behaviors. Mania can lead to impaired judgment, grandiosity, and sometimes delusions or hallucinations. Hypomania is a less severe form of mania, but it still involves elevated mood and increased activity levels. During depressive episodes, people with bipolar disorder experience feelings of sadness, hopelessness, and a loss of interest or pleasure in most activities. They may also experience fatigue, changes in appetite or weight, sleep disturbances, difficulty concentrating, and thoughts of death or suicide. But unlike ADHD, the mood changes in bipolar disorder are episodic and often occur in discrete periods lasting from days to weeks or even longer. These mood fluctuations are more intense than the mood swings typically seen in ADHD. Let's dive into the similarities between ADHD and bipolar disorder. Despite being distinct disorders, attention deficit hyperactivity disorder and bipolar disorder share some similarities, particularly when it comes to mood and energy levels. For instance, regarding impulsivity and hyperactivity, both disorders can have them. In ADHD, these behaviors are chronic and occur throughout the person's life. In bipolar disorder, however, impulsivity and hyperactivity might occur only during manic or hypomanic episodes. Regarding mood instability, both can have them, but in ADHD, this instability is usually due to frustration or irritability when faced with tasks that require focus or attention. In bipolar disorder, the mood instability is more pronounced and is marked by extreme shifts between manic and depressive episodes. Regarding difficulty concentrating, people with ADHD often have trouble focusing, which can lead to distractibility. Similarly, during depressed episodes in bipolar disorder, people may experience difficulty concentrating due to low energy and negative thoughts. During manic episodes in bipolar disorder, racing thoughts can also interfere with concentration. And now let's look at the key differences between ADHD and bipolar disorder. Although there are some overlapping symptoms, the key differences between attention deficit hyperactivity disorder and bipolar disorder include: first, nature of mood symptoms. In ADHD, the mood symptoms are generally stable, with irritability often arising from frustration or boredom. Mood swings tend to be short-lived and are not as intense or prolonged as those in bipolar disorder. In bipolar disorder, it is characterized by distinct mood episodes such as mania or depression that last for days, weeks, or even months. These mood swings are more extreme and often impair the person's ability to function in daily life. Second, onset and course of disorder. In ADHD, it is typically diagnosed in childhood, and its symptoms often persist throughout a person's life. While the severity of symptoms might change over time, the core features of ADHD generally remain present. In bipolar disorder, it most commonly develops in late adolescence or early adulthood, with the onset of distinct manic or depressive episodes. The course of bipolar disorder involves alternating periods of mood instability with symptoms-free periods in between. Third, sleep patterns. In ADHD, people might have difficulty staying on a regular sleep schedule due to their restlessness and hyperactivity, but sleep disturbances are generally not as extreme or episodic as in bipolar disorder. In bipolar disorder, during manic episodes, people often experience a decreased need for sleep, sometimes going for days without rest. In contrast, during depressive episodes, they may experience hypersomnia or excessive sleep. Fourth, risky behavior. In ADHD, while impulsivity might lead to risky behaviors, these behaviors tend to be more due to a lack of foresight or an inability to focus on consequences. In bipolar disorder, risky behavior, especially during manic episodes, might be more extreme and driven by a sense of invincibility, grandiosity, and poor judgment, often without regard for long-term consequences. How do we diagnose and treat both disorders? Diagnosing ADHD and bipolar disorder involves a comprehensive evaluation that includes clinical interviews, questionnaires, and observation of the patient's behavior. In some cases, further tests might be required to rule out other conditions that could mimic the symptoms of ADHD or bipolar disorder. For ADHD treatment, typically includes behavioral therapy and in many cases medications such as stimulants, Adderall or Ritalin, and many more, or non-stimulants like Strattera or Qelbree or many more, or manage symptoms of inattention and hyperactivity. For bipolar disorder treatment often involves mood stabilizers like lithium, Tegretol, Depakote, Lamictal, etc., antipsychotics like Seroquel, Caplyta, Vraylar, Abilify, etc., and antidepressants like Prozac, Lexapro, Effexor, and many more to manage the extreme mood swings. Psychotherapy is also an essential part of treatment for both disorders to help patients manage their symptoms and maintain stability. In summary, while attention deficit hyperactivity disorder and bipolar disorder can share some symptoms, they are distinct disorders with different causes, symptom patterns, and treatment approaches. ADHD is primarily a neurodevelopmental disorder characterized by inattention and hyperactivity, whereas bipolar disorder is a mood disorder marked by extreme mood episodes of mania or hypomania and depression. Accurate diagnosis and appropriate treatment are essential to managing these disorders effectively and improving the quality of life for those affected. May the inner peace that we cultivate today expand and guide us always. Until next time.